If you have diabetes, it's crucial to be aware of certain symptoms that could indicate a more serious underlying condition. Ignoring these symptoms can lead to severe complications and potentially life-threatening situations, which can significantly impact your quality of life and overall well-being. In this comprehensive article, we'll delve into 8 diabetes symptoms that you should never overlook, as early detection and appropriate management are vital for maintaining optimal health. Disorientation. Feeling disoriented, dizzy, slurring your speech, or appearing confused could be a telltale sign of low blood sugar levels, hypoglycemia. This condition, especially common in elderly individuals with diabetes, requires immediate attention as it can rapidly escalate and pose serious risks. When blood sugar levels drop too low, the brain may not receive enough glucose, leading to confusion, impaired cognitive function, and even loss of consciousness in severe cases. If you or a loved one with diabetes experiences disorientation, it's crucial to check blood sugar levels promptly and take corrective action, such as consuming a fast-acting carbohydrate source or administering glucose tablets or gel. Failing to address hypoglycemia promptly can lead to seizures, coma, or even death in extreme cases. Chest pain. While chest pain is not a direct symptom of diabetes, it should never be ignored, especially if you have risk factors for cardiovascular disease, such as high blood pressure, high cholesterol, or advanced age. People with diabetes are at a significantly higher risk for developing heart-related issues, including coronary artery disease, heart attacks, and stroke. Chest pain could be an indicator of a life-threatening condition like a heart attack or unstable angina. If you experience chest pain, particularly in the middle of your chest with a pressure-like sensation that worsens with exertion, radiates to your arm, jaw, or back, or is accompanied by shortness of breath, nausea, or sweating, seek medical attention immediately. Delaying treatment for a potential heart attack can lead to permanent heart muscle damage or even death. Numbness and tingling in the feet. Diabetic neuropathy, a common complication of diabetes, can cause numbness and tingling in the feet and lower extremities. This condition occurs when high blood sugar levels damage the nerves, leading to a lack of sensation in the affected areas. While it may seem like a minor issue initially, diabetic neuropathy can have severe consequences if left untreated. Without proper sensation, minor cuts, blisters, or sores on the feet may go unnoticed, allowing bacteria to enter and cause infections. These infections can rapidly worsen and spread, potentially leading to tissue damage, gangrene, and even amputations in severe cases. If you experience numbness, tingling, or any changes in sensation in your feet or legs, it's crucial to monitor them regularly and seek medical advice to prevent serious complications. Early intervention, including blood sugar control and appropriate foot care, can help prevent the progression of diabetic neuropathy. Blurry vision. Fluctuations in blood sugar levels can cause temporary blurry vision, a condition known as diabetic retinopathy. When blood sugar levels fluctuate rapidly, such as going from significantly elevated levels e.g. 300-400 mgdl to normal or low levels within a short period, the lens in the eye may swell or shrink, leading to temporary blurry vision. While this may seem like a temporary inconvenience, persistent blurry vision can be a sign of more serious diabetic retinopathy, a condition that can lead to vision loss or blindness if left untreated. Diabetic retinopathy occurs when high blood sugar levels damage the tiny blood vessels in the retina, causing them to leak fluid or bleed. Over time, this can lead to the formation of scar tissue, retinal detachment, and ultimately vision impairment or blindness. If you experience persistent blurry vision, make an appointment with your eye doctor as soon as possible for a comprehensive eye examination and appropriate treatment, which may include laser therapy, injections, or surgery, depending on the severity of the condition. Urinary problems. Urinary problems, such as frequent urination, inability to urinate, or incontinence, can be symptoms of diabetic neuropathy affecting the bladder and urinary tract. As diabetes can damage the nerves that control bladder function, individuals may experience overactive bladder, frequent urination or urgency, underactive bladder, difficulty emptying the bladder completely, or a combination of both. These issues should not be ignored, as they can significantly impact quality of life and increase the risk of urinary tract infections (UTIs) and potentially lead to sepsis, a life-threatening condition caused by the body's overwhelming response to infection. Chronic UTIs can also contribute to the development of kidney infections or even kidney damage if left untreated. Consult your doctor promptly if you experience any urinary problems, as they can provide appropriate treatment, such as medications to improve bladder function, intermittent catheterization, or referral to a urologist for further evaluation and management. Fruity odor in breath. A fruity odor in your breath, accompanied by abdominal pain, shortness of breath, or heavy breathing, could be a sign of diabetic ketoacidosis DKA, a potentially life-threatening complication. DKA occurs when the body cannot produce enough insulin or effectively use the insulin it produces, leading to a buildup of ketones acids in the bloodstream. This condition is more common in individuals with type 1 diabetes, but can also occur in those with type 2 diabetes, particularly if they are taking certain medications like SGLT2 inhibitors or during periods of illness or stress. The fruity odor in the breath is caused by the presence of ketones, which can also cause nausea, vomiting, and abdominal pain. If left untreated, DKA can lead to coma or even death. If you experience these symptoms, seek immediate medical attention, as DKA requires prompt treatment with fluids and insulin to correct the underlying metabolic imbalance and prevent further complications. Abdominal pain. Severe abdominal pain, especially in the middle of the abdomen radiating to the back, along with nausea and vomiting, could be a sign of pancreatitis, an inflammation of the pancreas. Pancreatitis can be a complication of diabetes or certain diabetes medications, such as incretin-based therapies e.g. GLP-1 agonists like liraglutide, semaglutide, or dulaglutide. The pancreas plays a crucial role in regulating blood sugar levels by producing insulin and other hormones, and when it becomes inflamed, it can disrupt this process and lead to severe abdominal pain. If left untreated, pancreatitis can become life-threatening, as it can progress to a severe and potentially fatal form called necrotizing pancreatitis. In some cases, pancreatitis can also lead to the development of pseudocysts, fluid-filled sacs, or abscesses, which may require surgical intervention. If you experience severe, persistent abdominal pain, seek medical help promptly for proper evaluation, diagnosis, and treatment, which may involve hospitalization, intravenous fluids, antibiotics, and pain management. Leg pain. Leg pain, especially when walking, should not be ignored in people with diabetes. It could be a symptom of peripheral artery disease PAD, a condition where the arteries in the legs become narrowed or blocked due to the buildup of fatty deposits plaque, reducing blood flow and oxygen supply to the lower extremities. PAD is a form of atherosclerosis, the same process that can lead to heart disease and stroke. People with diabetes are at a higher risk of developing PAD due to the damaging effects of high blood sugar levels on the blood vessels. PAD can cause cramping, aching, or pain in the legs or calves when walking, a condition known as intermittent claudication. If left untreated, PAD can progress and lead to non-healing wounds, infections, and even amputations, as the lack of adequate blood flow and oxygen prevents proper healing and tissue repair. If you experience leg pain, especially during physical activity, consult your doctor for proper evaluation, which may include tests like the ankle brachial index (ABI), Doppler ultrasound, or angiography to diagnose PAD and determine the extent of blockages. Treatment options may include lifestyle changes, medications, angioplasty, or surgery, depending on the severity of the condition. Diabetes is a complex and multifaceted condition that requires vigilance and prompt attention to any concerning symptoms. By being aware of these 8 symptoms and seeking medical attention when necessary, you can help prevent or manage potentially severe complications associated with diabetes. Remember, early detection and treatment are key to maintaining good health, preserving quality of life, and preventing long